Hello, my name is Dr. Sandra Cabot, and the topic of this presentation is why am I always tired? And what you can do about it. We're going to look at some common causes of fatigue that can be overlooked and how you can overcome them to restore your energy. First of all, let's talk about chronic fatigue syndrome, which is a big problem, and if you've been diagnosed with it, you know this is something you really need to get effective treatment for. But the thing about that diagnosis of chronic fatigue syndrome, or CFS, is it doesn't really give you a cause. So it leaves you wondering, well, why am I tired and what can I do about it? And that's why there are literally thousands of treatments that are promoted for fatigue, and people just find that it's overwhelming. Really, there's no one magic bullet which can overcome chronic fatigue syndrome. We need a proper diagnosis of the cause, and we need correct treatment. So we really need to be a bit of a detective here, and that's what you're going to discover in this presentation: how to be a detective for chronic fatigue syndrome. So if you have chronic fatigue syndrome, you can't afford to miss this presentation. It's going to help you a lot. To be tired all the time is not normal, but many people come to accept it. They think, well, it's just my lot in life, and they become even too tired to get proper help. And they just continue through life as a robot, putting one foot in front of the other. And this is no way to lead your life. You know, don't give up, and really find a doctor who's interested in the subject and listen to this presentation, and that will give you a good starting point and a good plan to work with. Let's start with possibly a hidden and chronic infection in your body as being a cause for fatigue. Well, this is something that could be very relevant. You could have a bacterial infection such as Lyme disease from tick bites, Streptococcus, E. coli, that could be hidden in your intestines. It could be in your sinuses. You could have a viral infection, and a lot of people who have glandular fever say they don't feel as well after it. Even years after glandular fever, they still feel tired and they can't get back to their previous level of good health. And if you've had a viral infection and you haven't fully recovered, you know, you may have had COVID or shingles, glandular fever, hepatitis virus. If you're not progressing, this means that the virus is still very active in your body, and there's way too much virus in your body, and you need to reduce the amount of virus. We call this the viral load, and this is possible to do with holistic medicine, and we're going to discuss how you can do that in this presentation. You could have a hidden fungal infection, a mold infection if you live in a moldy house, or if you've had antibiotics. And once again, we can diagnose that and we can treat it effectively. Another cause of fatigue can be a hidden autoimmune disease, and this causes like a smouldering inflammation in your body, and inflammation takes a lot of energy from your immune system. So it's very important to look for a hidden autoimmune disease with blood tests that look for antibodies or inflammatory markers such as CRP. And this can go on for years if you don't look for it. Other causes of fatigue are gut problems. Perhaps you've got a leaky gut, and this is a common cause of fatigue because you don't absorb nutrients. You have toxins that recycle from your gut back to your bloodstream and throughout your body. It can cause a lot of bloating, indigestion, and just general poor health. So one thing that really helps to overcome a leaky gut is glutamine powder. It's very, very good for healing a leaky gut. You just take 1 teaspoon 3 times a day in water away from food, and that will heal a leaky gut. Also, a 15-day cleanse can help a lot. Natural antibiotics that contain herbal antimicrobials, and intermittent fasting. All these things can make a huge difference to overcoming a leaky gut. We also need to look at the liver and the gallbladder, and we also need to look at the pancreas, because you may have a healthy diet. You may be eating very well and really putting in a lot of effort there with your diet, but if you are not absorbing your food because you have a lack of bile production from the gallbladder, a lack of hydrochloric acid production from the stomach, or a lack of digestive enzymes from the pancreas, you're not going to absorb the nutrients from your healthy food. So eating healthy food is a waste of time. And it's surprising how many people have a bile deficiency or a deficiency of stomach acid or deficiency of pancreatic enzymes, and they have chronic malnutrition and chronic fatigue from this. So we can overcome these problems very well, but we have to think about them. We have to be aware, and as Hippocrates says, all diseases begin in the gut, and there's a lot of truth in that. And if we start with the liver and the gut, and we repair that, then we come a long way towards overcoming fatigue. That's the starting point. Now, other causes of fatigue, we have to think about the adrenal glands, these little hat-shaped glands that sit on top of the kidneys, and they produce these very powerful hormones, adrenaline, and that's produced in the middle of the adrenal gland, and that gives us instant energy. So we want plenty of adrenaline when we need it. And also the adrenal cortex produces the steroid hormones cortisol and DHEA, and they give us endurance and they control inflammation. So very important to have healthy adrenal glands. And I've had a lot of patients over the years who've had adrenal gland exhaustion. I've even had patients who've had adrenal gland failure, and it hasn't been picked up for years simply because nobody's thought about it. So it's easy to check your adrenal glands with a simple and inexpensive blood test. And we can check the level of cortisol in the blood in the morning and in the afternoon. In the morning, the normal range is much higher than in the evening, and that is the body's circadian rhythm. And that's very, very important to allow us to relax and chill out and have a good night's sleep. So you don't want to be at the lower limit of normal here for your cortisol. You want to be in the middle. So let's say, the normal range here is 138 to 650. You want to be about 500. And in the evening, you want to be about 200, 250. And then your adrenals are pumping out enough cortisol. We can also check your DHEA, and you want that to be in the middle, say 4 or 5. You don't want to be 0.1, because then, you're barely hanging in there and your adrenals are struggling. Other causes of fatigue, well, low levels of the neurotransmitters that are produced in the brain. So that can cause mental fatigue, and it can also cause depression, anxiety, as well as chronic fatigue. So, your brain is a chemical factory, and it's making these wonderful neurotransmitters, dopamine, adrenaline and serotonin, and they enable us to think clearly, to feel emotionally stable, to focus, and really give us mental energy. And some of these neurotransmitters are made out of tyrosine, the amino acid tyrosine that we get from our diet, from protein foods, and that is turned into dopamine, which is a stimulating neurotransmitter and makes us feel satisfied. and then adrenaline, and that's the hormone that really gives us drive and enables us to face new challenges. So if we do have adrenal gland exhaustion or sluggishness, we can use the supplement of 5-hydroxytryptophan. We can use tyrosine, so that is a powder. You can get a tyrosine mood food powder, and that gives you a quick pickup. You can just stir it into water, and that will rejuvenate you. Within 5 or 10 minutes you'll feel an instant pickup, and the effect will last several hours. And I always say that tyrosine's good to use if you're having a bad day, because it'll pick you up for 3 or 4 hours, and then you can take it again if you need it. Whereas if you're having a good day, you don't really need to take it. Eating more protein really helps your brain to make neurotransmitters, and so does the ketogenic diet. You can try that for 4 weeks, 8 weeks. It can make a huge difference to the amount of neurotransmitters that are produced in your brain. Another thing that you must know about if you've got mental fatigue and depression is N-acetylcysteine, abbreviated to NAC. And there's been studies on NAC, how it can really help in treating depression, anxiety, and mental fatigue, and it can help people to detox. You know, if they've been dependent on substances or too much sugar, alcohol, NAC is a really good detox and will reduce brain inflammation and help your brain to make neurotransmitters, which are so important for our mental energy. Okay, what about nutritional deficiencies? Well, these can be a huge problem, and particularly in younger women who have heavy menstrual bleeding, they will often be losing a lot of iron. And iron is needed to carry the oxygen around your blood to all the cells in your body, and the cells use the oxygen and the nutrients to turn the nutrients into energy in the mitochondria. So if you're low in oxygen, your mitochondria are not going to make energy, and without enough iron, your cells will be struggling for oxygen. So we can easily test your iron levels here. You can see how much iron you should have in your blood. The normal range is 5 to 30. We don't want to be 5. You want to be at least 15, maybe 20. And that is the free iron in your bloodstream. And then how much iron is stored in your body is tested with the ferritin level. And the normal range is 15 to 300. Well, once again, you don't want to be 15. You want to be in the middle, maybe 200 would be good. And that is going to give you some iron reserves. So that's your stored iron. So that if in a hurry you need iron, those stores are sent into your bloodstream. So your free iron goes up and you have enough iron to carry the oxygen around. So if you're tired, for sure, have a serum iron study and have a look at your iron level, because iron deficiency is so common in women. Okay, other nutritional deficiencies that could be causing you fatigue, perhaps you're low in vitamin C, you could be low in B12, particularly if you're low in stomach acid, you could be low in B12, or if you're a vegan, if you're low in vitamin D, which is quite a common deficiency now because people wear sunblock and they're told not to go too often into the sun, and also they may not be absorbing the vitamin D from their food, particularly if they don't make enough bile or pancreatic enzymes. Another deficiency that's very common is magnesium, and this can really make you tired because magnesium is needed for 300 enzyme systems in your body. So you're not going to be having active enzymes in your energy pathways and your detox pathways if you're low in magnesium. And a blood test really doesn't tell you if you're low in magnesium, because most of the magnesium is found in your bones. So, a blood test may show normal magnesium, but you can be deficient. So I'd say to anyone with fatigue, try a magnesium supplement. It's harmless and it may make a huge difference. Another mineral that is super critical for energy is iodine, and I see a lot of people deficient in iodine because they don't eat seaweed or they don't take a supplement. And if you live a long way from the ocean, the soils are very low in iodine. Zinc deficiency is common, and we need a lot of zinc in our body for our immune system. Selenium deficiency is common, and once again, a blood test is not going to tell you if you're low in selenium, because most of the selenium is found inside your cells. And if you're low in selenium, you can have a lot of inflammation and also autoimmune problems and viral infections. Another common deficiency is protein. If you're not eating at least 1 gram of protein per kilogram of body weight, you're not getting optimal protein, and that is going to affect your muscles. You must get adequate protein for healthy muscles. You may have muscle fatigue and weakness, not be able to exercise as much, and also not be able to make enough neurotransmitters, so you could have mental fatigue. Another thing we need to check when we're tired is our liver. So perhaps you've got a fatty liver, or a liver that's just overloaded with toxins or been exposed to insecticides or toxic mold. Now, if your liver is fatty, you will have unstable blood sugar levels. So your blood sugar levels will be doing this, up and down like a roller coaster. And you'll be craving sugar, and you will need sugar a lot to have energy. And of course, this is not a healthy way to sustain energy, and it can lead to diabetes. So what people find is when they improve their liver function, their blood sugar control is a lot better, and they don't depend on sugar for energy. If your liver's not working properly, you could have reduced bile production, poor detoxification, so toxins will build up in your body. You could have sluggish metabolism and weight gain, particularly around the abdominal area, and increased inflammation. So very good to check your liver with an ultrasound scan and with a blood test. And if you do have fatty liver, it's very important. We need to change your diet and give you a good liver formula. Another common cause of fatigue is lack of sleep, and particularly deep sleep. And when we go into a deep sleep, our brain changes. It actually opens up spaces inside of itself to allow the fluid that washes the brain to flow more rapidly and to clean the brain. So deep sleep enables your brain to wash itself, to have a deep cleanse. And this has been proven with brain scans. And people who don't have enough deep sleep, they have a build-up of toxins in their brain, and they get brain inflammation, and this really affects their moods, makes them very tired, gives them that foggy brain syndrome that so many people complain about. So if you're not getting adequate sleep, things that can really help is a good magnesium supplement, which will calm the brain waves and really help to give you more deep sleep. The hormone melatonin will help to put you asleep. Medical cannabis can help sleep, particularly in people with bad anxiety or pain. Also, improving the gut microbiome will really help to reduce brain inflammation, and that will enable you to have a deeper sleep. And doing some meditation before sleep, maybe just 10 minutes of breathing meditation, so that you can stop thinking and just focus on your breath, and that will really help your brain waves to slow down. So all these practical tips can make a huge difference. So there's many other causes of chronic fatigue syndrome. Some are obvious, but some are much harder to detect. So it's very important to see a doctor who's interested in chronic fatigue and have regular follow-up visits until you find all the relevant causes, we need to test the immune system, the nutritional status, and the hormone levels. And if we don't find a cause of fatigue, then I would recommend you go and see a specialist in fatigue, and particularly one who is interested in mitochondrial disorders and genetic variations known as polymorphisms, because they can be treated and often will remain undiagnosed if you don't go to an appropriate specialist. So very important to persist in finding all the causes. Another very important thing to check is your adrenal glands, and here we can see the adrenal glands on top of the kidneys. And what can we do if we find on a blood test that our cortisol levels are a bit low, maybe not too low enough to need cortisone tablets, but they just need rejuvenation? Well, the things that can really help is vitamin C. Your adrenal glands need a lot of vitamin C, so I'd be taking 1,000 to 2,000 milligrams a day. Vitamin D, check your vitamin D levels. If they're low, that could cause inflammation, and by taking a proper dose of vitamin D, that can help to rejuvenate your adrenals. Another thing that can really help the adrenals is N-acetylcysteine, or NAC, and that can repair damage in your adrenals, and particularly if you also take selenium with the NAC, you'll boost your glutathione levels, and glutathione is the most powerful antioxidant produced in your body, and it can repair cell damage. And in people with adrenal exhaustion and chronic fatigue, there's often a lot of cell inflammation and cell damage, so we need to repair the cells. So we do that with N-acetylcysteine and selenium. Another thing that the adrenals need is magnesium, because we know that magnesium is needed for many enzyme systems in the body, including the adrenals. Now, if your DHEA levels are very low, and remember, DHEA is made in the adrenals, and as we get older, we don't make nearly as much DHEA as we do when we're young. And this can be one of the reasons why older people get more fatigue. So if your DHEA level is at the lower limit of normal, I would take DHEA, perhaps 10 milligrams a day, 15 milligrams a day. Take it in the morning, can make a huge improvement. Now, if your adrenals are really struggling and they're at the lower limit of normal, you could try low-dose hydrocortisone, which is bioidentical to your own naturally produced cortisone. Now, you need a prescription for that, and often you don't need very much, maybe 4 milligrams or 8 milligrams in the mornings, and that can really get you going in the mornings, and that can be prescribed by your own doctor, or you may want to go to a specialist to do some more fancy tests for your adrenal glands. And believe me, it's worth it, because it's not something that you want to put up with, is adrenal gland exhaustion, and it can be effectively treated. Now, another hormone that is extremely important for fatigue is testosterone in men and women. And it is a hormone that gives us endurance, physical strength, it helps our mood, it helps our libido, definitely an anti-aging hormone. And it's not uncommon to see people with abnormally low levels, even younger people, and this can be related to our environment, to exposure to toxic chemicals which are blocking the production of testosterone, or due to the wrong diet. If you're eating too much carbohydrate, not enough protein, you're overweight. In men particularly, that could cause low testosterone, fatigue and depression. So if you do have low testosterone, we can give you a supplement of testosterone in the form of a cream, which you just rub into the armpits, or lozenges known as troches, or in men we can use injections. And we can also give you DHEA as lozenges or creams. So this treatment can make a huge difference in your mental and physical energy, and it can work within a week. So you'll soon know if it's working. You won't have to try it for months wondering if it's going to work. So let's look at a blood test for testosterone. Now, in women, the normal range is 0.1 to 1.8. In men, it's much higher. It's 11.5 to 32. So you don't want to be at the bottom of the normal range, 0.1. Well, then really you've hardly got any testosterone. And I see people where it's below 0.1 and it's too low to measure. You want your level to be in the middle there. So around 2 would be good for women, and in men, say around 20, 25. And if you're an athlete, probably higher, even around 30, 32. And as I said, it really does vary with your diet. So sometimes you can really boost your own testosterone level just by cutting out the carbs and having more protein. So these blood tests, very, very accurate. They're not expensive, and they're very important in somebody with persistent fatigue. Now, we mentioned that a lot of people have liver and gut problems causing their fatigue, and it's always important to address the liver and the gut. I like to start there because, you know, the liver is the organ that detoxes you. It removes all the chemicals that you don't want accumulating in your body, and a lot of these toxins, they are fat soluble, so they get into the fatty parts of your body and they stay there unless your liver turns them into water soluble substances. So your liver takes the toxins, and through phase 1 and phase 2 pathways it turns them into water soluble substances, and only then can they be eliminated from your body in watery fluids like the bile into the feces and the kidneys into the urine. And of course sweating also helps, so drinking water, working up a sweat, having a sauna, that will help to eliminate the toxins that are broken down by the liver. And things we can do to help our liver, we can take Livertone Plus, which helps the phase 1 and phase 2 pathways in the liver. We can take glutamine powder to heal leaky gut so we don't get the toxins recycling back through the bloodstream to the liver. We don't want that recycle of toxins. If there's a lack of bile, we can take ox bile capsules in the middle of the meal because, you know, bile is a very important way to eliminate toxins. We can take digestive enzymes. We can take fermented foods because that will help to heal a leaky gut and improve our gut microbiome. And we can do intermittent fasting, which is so helpful for a leaky gut. So all these things are going to help to eliminate toxins from our body, from toxic mold, from plastics, from petrochemicals, insecticides that will otherwise stay in our body, cause inflammation and cause fatigue. Now, another very important thing to consider if you have fatigue is chronic infections. You may have a chronic infection with a virus. If you've had glandular fever or shingles or COVID and you're not improving, you need to take selenium. Selenium is the viral birth control pill. It's been proven in lots of studies to reduce the ability of viruses to replicate in your body. So it will reduce the viral load. It's clinically proven to do that. It's essential. And some people can never get over these viral infections because they're selenium deficient. And you can't really check with a blood test. You just have to try it and see if it works. And, you know, I've had cases of people where they've been really chronically ill from a virus for years, and within 3 or 4 months of selenium supplementation, they're cured. It's amazing stuff. Vitamin C to boost the white blood cells. That will help to fight infection. Vitamin D is antiviral. N-acetylcysteine. Now, N-acetylcysteine is unique here because many chronic infections persist because of biofilm. And biofilm is a mucus-like substance that is secreted by the infection, and it protects the microbes from your own immune system and also from any antibiotics. So you may have taken antibiotics and they worked a little bit, but not 100%, and the infection keeps coming back. That's because the antibiotics are not able to penetrate the biofilm, and of course some microbes are resistant to antibiotic drugs. That's a big problem these days. Now, it's very common for biofilm to build up in chronic infections, perhaps in the bladder, in your sinuses, in your lung bases, in bowel pockets, and unless you break down that biofilm, you will not overcome a chronic infection. NAC has been extensively studied and proven to eradicate biofilm. It's the best thing by far to get rid of this horrible mucus-like biofilm, and you'll need 1 to 2 capsules twice a day with a whole large glass of water, and you may need to take it for quite a few months because remember, it takes years for this biofilm to build up. You can also take natural antimicrobial herbs such as Bactoclear. You can take garlic, horseradish, onion. All these things have natural antibiotic properties and can help a lot. And the interesting thing is that the microbes do not become resistant to natural antibiotics, which is different to antibiotic drugs. Mitochondria, they are the energy factories, bean-shaped structures, microscopic in size, and there's many mitochondria in every cell in our body, and they take oxygen and nutrients such as glucose and fatty acids and turn them into energy known as ATP. And this is the energy that sustains our life. So we need plenty of mitochondria, and we need healthy mitochondria. Otherwise, we're not going to make energy, and we'll have tired cells, and we will be tired. So mitochondria are very important, and a lot of people don't think about that when they're tired. And you know, we're really talking here on the cellular level. Why are we tired? Well, we've got tired cells. Let's rejuvenate our cells. So how do we rejuvenate our mitochondria? Well, we need to exercise more. Moving enables your cells to make more mitochondria, and indeed athletes can double the amount of mitochondria in their cells just by the amount of exercise they do. Don't eat too much. You know, it's okay to be hungry. Intermittent fasting is great for your mitochondria, whereas if you eat too much, particularly if you eat too much sugar, you'll actually fragment your mitochondria. They'll break down and they won't be able to use the nutrients in the food for energy. So it's better not to overeat and not to snack too much. The other thing that's really bad for your mitochondria are these omega-6 fatty acids found in processed vegetable oils. So things like rice bran oil, cottonseed oil, safflower oil, you know, all these processed foods that are high in these cheap plant vegetable oils are really bad for our cell membranes. And remember, our mitochondria have membranes, so these bad omega-6 fatty acids clog up the cell membranes, and the membranes don't work and you can't make energy. So what we want is good natural fats like omega-3 fats from fish, some saturated fat from animal products, nuts and seeds. In other words, unprocessed food. The other interesting thing about mitochondria is your mental state, and researchers found that if you're happy and you're doing things that you enjoy, taking time for yourself, following your passions, challenging yourself, you know, spiking your adrenaline with things that you love, then you'll make more mitochondria. So that's a good excuse to be a little bit selfish, isn't it? You got to have fun. So there you go. We've covered a lot of the causes of fatigue and what you can do about it. And if you are a tired person, I hope that this has helped you. I've seen many tired patients. I've been a doctor for 50 years, and it's one of the most common complaints. And, you know, you have to be a detective. You have to really look, and you try to find the causes, and you try one treatment at a time. As I said, there's no magic bullet, but you can overcome fatigue. You can restore your energy. And really, you know, if you're struggling, send us an email. We love to receive your questions and your emails. Send us an email to support@liverdoctor.com. And thanks for listening. Bye for now.